Thank you so much for staying with us right here on Amka Kenya. You are watching Amka Vibe Check, and I'm very excited for this conversation because today we want to showcase to you the proper way to handle any matters that is concerning breastfeeding. Our guest in studio has come prepared. You will see what I mean in just a few, but let me introduce her to you. Her name is Esther Kimani. She's a doula and lactation specialist, and this week basically we are highlighting Breastfeeding Week, and the theme is Prioritize Breastfeeding, Create Sustainable Support Systems. And Esther Kimani here is going to be highlighting this particular factor for all you new moms, for all you moms-to-be, for just women who are curious, for all of you who would want to, be a proper support system to the women around you who are in this particular amazing position, if I may say. Esther Kimani here will be able to take us through this process. And remember, you can also, of course, engage us in our conversation this morning. And we're asking you, what is the single most impactful change that would better support breastfeeding mothers in your community or workspace? What is the single most impactful change that would better support breastfeeding mothers in your community or workplace? Our WhatsApp line, as you can see, is on your screens, and our handles on X and Facebook are the same, and that is at K24TV. Please do send us your feedback, your questions, perspectives. Would love to know your thoughts on this conversation. So once again, Esther, thank you for being here. Hi, how are you this morning?
I'm good. Thank you for having me. Great. This is my favorite week of the year.
It is your favorite week of the year.
Yes, because breastfeeding is my passion.
And I love the fact that you've come with this dummy live African baby boy.
I know.
It's live.
He's so adorable, isn't he?
No, it is. That's a very cute. And I love the representation there.
Yeah.
I know many would appreciate that particular detail, especially. So, Esther, like I said, you are a doula and lactation specialist, and I don't want to assume that for some it's an obvious aspect as to what a doula is. Lactation is, as the word suggests, but I would like you to define for us what you do.
So a doula is someone who supports parents from when they're pregnant, during birth, and after the postpartum period. And basically we offer informational support, physical support. We are trained in ways, especially during labor, to help a mom labor more efficiently, help the baby and the mom work together during the birth process, so that the process can be as physiological as possible, not to have as many interventions. And then later support them when you go home, helping you figure out how to take care of this baby. A lactation specialist is someone who is a professional that is trained in matters lactation. So helping you through the challenges that come with lactation, helping you through figuring out how to be able to effectively create a good breastfeeding journey right from the beginning, and ultimately helping you figure out how to continue breastfeeding your baby until the age of 2, which is what we recommend.
Okay, Right, so Esther, as we're of course having this conversation and elaboration, I think you'll just turn our baby dummy to the other way. I think the other way around. Yes, that way, our audience so can be able to see the face. And the demonstrations that you'll be having. But I think before we get into that, there are very many myths and facts when it comes to breastfeeding. But one of the key aspects about this theme this year is the support system, the ecosystem that women need to have. Like you said, rightfully, women are guided, when it comes to pregnancy. But when it comes to after, that's where the issues are, because sometimes, sometimes, all the time, you're giving your baby, you've just given birth, you're like,
how do I do?
You know, and like upon make it vizuri, like, you know, let the baby latch. You're like, what?
What does that mean?
And sometimes the mother will struggle, put the baby there. The baby is not latching. It's doing nothing. The mother starts crying. The baby is crying. The baby is hungry. And like, no, the baby has to stay there. You're not going to, we're not going to give you anything, you know, in some extreme cases. But I want you to articulate that matter for us.
One of the support system that we're talking about that is sustainable is we need to start having information and classes before a mama has her baby.
Right.
Because having that information before, studies have shown that when a mom is educated about lactation before she has the baby, she has a higher chance of a good breastfeeding journey, because she's able to anticipate the things that happen. She's able to be taught, what does a good latch look like? How do you hold the baby? Practicing even with a doll. When I teach classes, I teach with a doll, and that actually helps the new mom already have an idea. Even if you're going now to get better at it as you have with your baby, as you get your baby, then you actually become more confident. But at the beginning, having that information, it makes a difference. Okay. Second thing is the healthcare workers. I think there's they have the information, but with time, maybe the time is not there enough to be able to cater for all the clients they have or the patients they have. So having people dedicated to just lactation. In most hospitals, like in the West, there's a dedicated nurse that is there for just lactation.
Are you a wet nurse?
Yes, exactly. You know, so in our systems, in the hospitals, there could be just one nurse or two that are just dedicated to going around and supporting that mom who's just had her baby, because we do encourage initiating breastfeeding within the first hour of life. But you might find, like in most of our health systems, they don't have enough resources to have like one midwife is taking care of the mom that's delivering her baby, then the other one is maybe taking care of in the postpartum place, but who is taking care of that mom who is just learning how to initiate breastfeeding. So there are all the support structures that can have. In the community, we now have community health workers. Can they also be taught how to be able to support a mom through the breastfeeding journey? So when this mom comes home, someone is coming home to be able to help and figure out what challenges are this mom having, how can we help? So there's a whole ecosystem that needs to be set up to be able to create sustainable breastfeeding support in the community, in the workplace, you know, in all areas where these breastfeeding mothers are.
Got you. That's quite key. Now, I want to key in to something very important that you've mentioned, which is holding the baby. This is a newborn, okay? And I'm sure for moms and even some dads, just friends and relatives, mshike kichwa vizuri, very sensitive, you know, like place the baby this way or that, you know. So I want you to show us, it's a newborn, you've been given the baby by your nurse, and now you're told to hold your child so that you can breastfeed them. Okay. What position are you supposed to hold them in? And now, how are you supposed to make sure that you put them in a position where they'll be comfortable to latch? And is it automatic? Please, I know I said it's not, but for reasons that we need to make clear that they will automatically latch.
So one of the things that I say is that babies have a reflex, and that's the sac reflex when they're born. They also have another reflex, that's the they also have another reflex that's called the rooting reflex. The rooting is they're looking for the breast when they go like turning their head, you know. They're looking for it
instinctively.
Instinctively. So that those two are very, very strong immediately after birth. And when the baby is born, they are expecting that there's something I need to be looking for, but I don't know what it is. So that's why it's very important to initiate breastfeeding within the first, we actually call it the golden hour, because the baby's reflex is strongest then. But it's a reflex. It's not yet a skill. It is a reflex. It's something that the baby will figure out and learn. Now, mama, on this other hand, has to help attach that baby, because you need now to connect this reflex with the breast, right?
Yeah.
So helping the baby get into a good position
Okay.
starts with the mama herself. So she needs to be comfortable.
Okay.
So
And when you're saying comfortable,
yeah.
how does she need to be sat?
So she needs to be straight. She's not hunched over. So she can support her back with a pillow, or just have, if she's on a hospital bed, she can sit on the bed. Be comfortable and be upright, right? When you are comfortable, then it's easier for you to attach the baby.
Okay.
Then now we have our baby. Yes, babies need to be held properly because they cannot yet support their head. And then you bring them and then ensure that they themselves are well supported.
Okay.
So it means that, first of all, the baby needs to face their food. So the same way you face your food. So I find many moms holding the baby like this and turning the head to the side.
The whole body
needs to turn. Okay. If I'm taking water and I'm like this, it's very difficult for me to drink water. So ensure that the baby's whole body is supported. So you can see like the head, the back, the bum, it's all, the baby is well aligned. They are facing the same side, right? And then they also need to come as close as possible to the breast, because if they're down here, then mama will need to bend down.
Right. So you're supposed to lift the child.
You lift the child. So you can have a small pillow. It doesn't even have to be a breastfeeding pillow, just a small pillow to help support the baby so that the baby is as close as possible to their food, as as possible. Yeah.
Yeah.
And then I will have a boob here. So once the baby is close by, now remember I said the baby has a suck reflex.
Yes.
So the amazing thing about your breast, when you give birth, when we say, you hear a lot of people saying, mtoto ananusa maziwa. Yeah, like they're smelling their milk. And that's because
the food is walking, basically.
Yes, exactly. Around the breast when you're pregnant, there's these little dots that come in. You find these little dots that grow on your breast when you're pregnant. And they are responsible, they produce a small oil. And that oil actually has a smell that is similar to amniotic fluid. So when the baby is in the tummy, they tend to suck and smell, and they suck in and they suck their finger. So once they come near the breast, what do? They smell that. And that triggers the reflex we're talking about, the suck reflex and the rooting reflex. So
because they're already familiar with the smell
from the womb. And when they smell that, they go like, I want to suck this, that's smelling like what's in the womb, right? So when I'm attaching my baby, I am aiming to have the baby actually get this nipple as far in as possible into the mouth. Now, when I'm sucking my thumb, most times if I'm sucking my thumb, I wouldn't suck my thumb like this straight, right? I would put it up towards you'd put it up towards like the top of your mouth. Yes. So aim for your nipple to go up to the top of the mouth. That means that, yes, you point it to the baby's top lip. So when you point it there, the baby goes like, what's this? And they go like,
and others get so afraid.
Exactly.
Because they think that they are harassing
the baby.
Yes.
Yeah. But it's an instinct. Because if now this is my breast, so I'll hold my breast with a C like that. Because if I do like this, then I am taking the space where the baby is supposed to go. Because the baby is supposed to get the whole...
And some people do that.
Exactly. So you hold like this, and I keep saying it's like a sandwich. If I'm eating a sandwich, what do? I take it and I squeeze it so that it can fit. So you do the same with the breast. And then now when you put it on top of the baby's top lip, the baby will open their mouth, and then the baby comes onto the breast. Not you going to the baby does what? Comes the breast. When the baby starts to suck, you want to see a few things. You want to see the baby's mouth, the chin and the breast are touching. So the chin and the breast should be touching, like this baby here. So basically, maybe I can tilt a bit so that the camera can see. So the baby's chin should be touching
I see what you mean, because
Yeah.
you find that
Yeah.
some women, when they're breastfeeding,
Yes.
you think that the baby is struggling, they're suffocating, 'cause
Suffocate,
they're not
exactly.
breathing right.
And that's because you tried to align it like that, which means that the nipple is not going to the highest point of your of the mouth, of your palate.
So then
Yeah.
others would argue, you know,
Yeah.
at the end of the day, we usually have, of course, the milk will fill in you
Yeah.
know, the breasts.
Yeah.
So you will not be the way you
Yes.
usually be.
Yeah.
Now, would the size then matter when it comes to how you're latching the baby onto you?
Onto you? Not really, because if you have a bigger bust, what you do is fold a little towel, put it under your breast
Right.
to offer more support,
Okay.
so that now you're able to still attach the baby the right way. So if you have a smaller breast, that's still the same. So the process is the same. You want the baby to be able to get into start feeding, as they suck, the cheeks should puff out like this. If you're seeing the baby going like this,
Yes.
they don't have enough breast tissue in the mouth. They're not attached properly. You would
So
not
they're
hear,
struggling.
yes, they're struggling. It's almost like trying to get milk from a straw, a small straw. So they need to get a good latch so that they get good milk out of the breast. Then you'll find like it doesn't hurt because the nipple is further in. Because if the nipple is trapped between the gums, that sac is really strong. It's going to cause little tears along the nipple,
And that is why
hurts.
people oh.
Yes. So that's
Yeah.
why when you put the baby onto the breast, aim for the top lip like that, so that the baby and don't be holding the baby's head, because the baby needs to tilt back. So if I'm sucking and they tilt back, then it means that they can be able to get it further up into their breast.
Got you.
If you're holding the head, then they are forced to just take a little. But when they go in,
So the assumption
exactly.
is that when you're holding their head,
Yes.
actually that they're getting more.
Getting
but it's
more,
not.
no. Yeah, so you support the neck, and if you're using different positions, so you can use this position, you can use what you call a cross cradle, which means I hold the baby like this, and I attach them, and you see, I'm not on the head. I'm allowing the baby freedom to be able to move their head.
Yeah.
And whichever position it is, I can be like this, like for moms with twins, and
Yes,
they're
sorry about that.
sorry about that.
Yeah,
Let me
you
pick
can
my-
pick it. Yes.
yeah. So my moms with twins, I can have one baby here and I can have another one here. So I can use the rugby hold. Some people call it the football hold, but in Kenya it's more of rugby.
Yeah.
The rugby or the clutch hold. I can even have, I can be lying down. So there are different positions, and you can be supported to figure out which is the best position for your baby and you, so that you're comfortable.
Right. There's
Yeah.
a concern, Esther, of women who would have issues with inverted, nipples. So how would they go about this
Yeah.
aspect?
Yeah. So an inverted nipple basically is like, it's like that. It has a
Yeah.
hole. It's
Yes.
like a hole right there. And with the inverted nipples, usually it can be, and sometimes it can be flat, or sometimes it can have that little hole there.
Yeah.
So I have a little gadget basically, if you find, this is actually a very cheap gadget found in baby shops. It's probably about 200 shillings. And so just before you feed, and it tends to be less painful than the syringe. So sometimes in the hospital, they cut a syringe,
Yeah, and then
and then you pull. So that's really painful.
Yeah.
This one, even, you can see, if I can put
like
it
a
on my
suction.
skin, a suction. So it's pretty simple. Come and put it, and it kind of pulls the nipple out, and then now gives a place for the baby to attach.
Right.
But at the end of the day, the baby does not nipple feed. The baby breastfeeds. So you can form a sandwich like that and have the baby attach onto the areola. And by making sure that you've made it soft, so if the boob is full, massaging it a little, expressing a little, so that this part becomes soft. The areola is the dark part. And then sandwiching it so that the baby now gets a good latch of the areola. So even with inverted nipples, it's very possible to be able to breastfeed. Yes.
All right, then.
Yeah.
Right, let's take a look at some feedback. I mean, this is a very informative session. So we want to remind you what we had asked you earlier on. And our question is, what is the single most impactful change that would better support breastfeeding mothers in your community or workplace? Let's take a look at what you've had to say on the same matter. Now, Mercy Naliaka from Kakamega says, create clean and private lactation rooms in all public buildings and offices. Yes, quite imperative. Thank you, Mercy. Janet Karaoke from Rongai says, longer maternity leave, 3 months is not enough for bonding and proper breastfeeding. All right, Janet, thank you so much for that. We also do have Patricia Mwende from Mombasa who says, educate employers about the importance of breastfeeding. Some just don't care until they're forced. Oh, well, that's quite unfortunate. We also do have Cynthia Abdi from Thika who says breastfeeding breaks should be legally protected and scheduled fairly. All right. Well, there you go. As you can see, for most women there's a concern of the workplace being conducive for mothers to actually be able to express, right? Because you have to come to work and, oh my God, the hustle of, you know, you're from your maternity leave and you have to find, you know, a spot if your office doesn't have one to express is wild, is insane because your breasts are full. And you're there with your gadgets and stuff, and you just have to sit there for a while because you can't stay with all that milk, you know, on you or in you for that matter. So, what do you think would be a very practical measure?
I love what one of your callers talked about. It is protected. The time to be able, those breaks are protected by law. You do have 1 hour and your lunchtime to be able to take breaks to go and express milk. Now, if you do not express milk at work, your brain goes into a negative biofeedback. So you'll be full for 2-3 days, then the milk goes away. Because how breast milk works, it's a breast brain, and removal of milk creates more supply. When you don't remove milk, the brain goes like, oh, we don't need milk, so let's not make milk. So one of the ways to ensure that you're able to do exclusive...
But it's also so painful to have it in
Exactly.
there.
So it can lead to engorgement, mastitis, which is an infection of the breast, and it's very uncomfortable. So when you're going back to work, plan ahead. Talk to your employer and say, okay, I have 1 hour protected time plus my lunch time. That means that I used to feed my baby at home every maybe 2.5 hours or 3 hours. So I'll come in at 8, then at 10, I'll take 20 minutes to go and express. Then I'll do another maybe 20 minutes at about 12. Then I'll do another expressing maybe at 2:30, you know, and then I'll probably, is it possible for me to leave work at 4? You know, working out systems with your employer. And this is a conversation that we need to have because we need that employment space to be able to be protective over the breastfeeding mothers. And they're protected by law, but it's just having a conversation so that this mama can be supported. When a baby is exclusively breastfed, to be honest, they're healthier. That employer will be happier because she knows that her baby is having her breast milk at home, and that means she's happier to work and she works better. She's a better employee because she's happier, because she's settled that her baby is okay. Her baby does not fall as sick, so having to take sick off or going to take her baby to hospital because her baby probably is having constipation because the baby was given, you know, infant formula that's not working. So it is beneficial to you as the employer to support that mom to be able to continue giving her baby breast milk and express. So creating those structures are important. Start planning early as the employee or you're breastfeeding. Start teaching your body how to remove milk right from about 2 months. After the baby, the first 2 months or the first 6-7 weeks, start planning figure out breastfeeding, it's working, it's great, then let's now start learning how to express.
Got you.
So that by the time you're going back to work, you are confident and you're good at it. Learn how to store milk, how to, you know, keep it in the fridge. What happens, the milk you express at work, how do you store it safely so that you can carry it back home so that the baby can be given? So all those are things that you plan ahead for before you go back to work.
Right, Esther, thank you for that. Now, we're taking a short break and we'll be back with more of this conversation. Stay with us.